So welcome everybody to this workshop. We're really looking forward to hearing about this very exciting, innovative solution. And it's my pleasure here to introduce our presenter, Dr. Alireza Kazemi, and also one of our leaders for this conference, and also the ideas and the brains behind this solution as well, Dr. Michael Krausz. So Alireza will, I think, start us off with just talking about the solution. He has a very fitting job to create a solution such as this, because he is an MD as well as a PhD in health informatics. So he really comes from both sides in understanding health needs, clinical needs, as well as the technological needs for developing a solution such as this. And then I think Michael will also explain some of his thinking and ideas behind this solution, which is called RAMP. I'd also like to invite all those who are in the audience, if you're comfortable, you can unmute and ask questions, but at the same time, if you like, you can put your questions, discussion topics, or if there's anything unclear about the solution you'd like to bring up some chat items, just put that on the side there, and I will keep an eye on that and ask our presenters as they move along the presentation. Great, thank you. So Alireza, if you can start your presentation.
Sure. Good morning, everyone. And but I don't know if Michael, if you can just kindly give a very short introduction to the ideas and everything behind this application, then I can go ahead and start the presentation, actually the actual web portal.
Okay, while you're starting the web portal, let me share a few introductory remarks. So RAMP is a system which is focused on the current situation, on the current public health crisis in British Columbia. It is a web-based solution, which is pretty much built in the same sense of philosophy as Ian Hickey just described for the Australian solution. It's a modular system, and this modular system is now very much focusing on high-risk substance use and overdose, but it is constructed in a way that we can add other clinical trajectories in order to, for instance, do something similar. We are presenting to you right afterwards, focusing on overdose, for instance, on suicide or on other critical risk constellations in psychiatry and in mental health services overall. The concept and the main issue is to build capacity, to make access to care easier, and to help users to navigate the system of care, and to provide quality online tools, which would cover a lot from our end, a lot of the needs of our clients with a web-based, in a web-based environment. I will explain a few more details while Alireza started the online demonstration.
Thank you very much, Professor Krausz. And so I will start presentation. Thank you everyone for joining us. Today we will discuss about risk assessment and management platform. As Dr. Choi just introduced me, I'm working with the group since 2015 and currently mostly involved in the RAMP and the development of RAMP and testing of that. So I would like to start by acknowledging that we are living on the traditional, ancestral, and unceded territory of Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh nations. We thank them for having cared for these lands and waters since time out of mind, and we don't have any conflict of interest, including any relationship, financial relationship with the company that has developed RAMP. So I will start with the approach. So The approach that we have in the system is that we hope by promoting the platform through conferences and introduction and also through the social media and all different kind of techniques and strategies that we have, we hope that the user visits the platform and with the features that we have, and we have it even before the registration, they're available, so they get engaged with the system, and in some point of time they register. When they register, then the HRA is proposed to them. So HRA stands for High Risk Assessment, which is a very comprehensive 29-question assessment that ask about different background questions and also about substance use and concurrent disorders. And there is a decision support system behind the scene, which actually goes through the answer and based on the accent based on the answers, provide a personalized education and information in module or modules, and also ways to interact with the system, such as the emulation that I will explain further. Also offering other assessments and more importantly, some relevant goals. The two most relevant goals and health tasks, which the health task means that they are actual, objective, or they can be kind of behavior management techniques, activities, behavioral therapies, symptom checks. And when the person or the individual starts the intervention or working with the intervention, that then the system can track the progress via a feature called Life Chart, and then it will provide email reminders on a regular basis based on the interaction style of the user. And then in some point of time, again, this HRA is proposed, and this loop will continue as this improvement loop continues. Then the person hopefully can improve their health. So this is the approach that we have. So as technical background of the system is a web application. It's not an app. It's a web application responsive to mobile devices, so that people that they will use their cell phone, the size of the screen will adjust to the screen size. And it's built on a content management system named WordPress and is available via wrap2.walkalong.ca. So by saying about this, I can start the live presentation. Today we have a little bit problem with the server internet speed, but I hope that we can still present the system. So if you put this link, then this is the public page that you will see. This is actually the RAM public page. It's a 1-minute introductory video here, and it also explains what is RAM and the features that are available. Some of the features that are available even before registration are also listed here, and the person can go and browse and see that if they are interested to actually register. But the
sorry, could you show the?
And I will show all of those features in just a bit, Michael. And okay. So if we start with the registration here, so when we go to the registration, you enter your user, password, your first name, last name, and then you register. Upon registration, then you can log into the system. So if we get into the system, so here I am presenting actually the system. So you enter your username and then your password. And then you enter into the system using the log. When you log in, you will see this home page. So the features that I will explain will also be available on the public page. This is the reason that I'm saying that I will present all of these things at the end also again for those that who have not registered with the system, how they can access. So actually, this is the home page. The home page includes 3 sections. So on the right, it's a helping crisis button that, for example, here, it shows that ramp is not for the emergency situation. And if you are in an emergency, in a crisis, you can get help from these links. And your main interaction with the system, it's called My Journey. This page concludes your interactions with the system. So you can see here, for example, what kind of assessment you have been doing, what kind of modules you have been completing, what are the suggested modules, what kind of goals you have been setting, and those kind of things. So based on the model that I described, if you register, the first thing that you will go through is the assessment. So here is the assessment. If you click on this, then the assessment will show up. So currently we have added 3 different assessments: GAD-7, high-risk assessment, and PHQ-9. As you know, GAD-7 and PHQ-9 are 2 standard assessment for anxiety and depression. This is a 7 question, this is a 9 question. But among the 3, high-risk assessment is an assessment that was developed by the team. And I will click on the link, high-risk assessment. As you can see, this page will show your latest result in this week. For example, it shows that on Monday, my risk score was 43 and Tuesday was 41. I can increase the time span, for example, having that for 2 weeks. And then it will show my latest result in the last 2 weeks. And I can see a pattern here that was decreasing. Usually you do an assessment every 2 weeks, but this is just for the demo purposes and demonstrations. So I'm going through the assessment itself. I have been doing the assessment, so it says that redo the assessment. If I want to do an assessment here, which is a high-risk assessment, I will click on this link, and these are the questions that I will get. For example, the age that I have, kind of the sex, but I can also show you this heat map here. As you're answering the question, the risk increases. So it shows that, for example, it is increasing by 2 score when your age is below 60. For example, if you're male, then another 3 score is added, so it becomes 5. And this is the same for the other question. As you answer, the risk score will change. If it is a protective factor and you're answering yes, it will reduce it. If it's a risk, then it will increase your risk. Some of the questions, like question number 6, they have tally questions. So for example, if you say that you have experienced any symptom of mental illness, then the system will ask what kind of illness it was. And if you say it was other, then you can specify what kind of other mental illness you had. So it goes like this, and it's 29 questions. So I'm not going through the whole assessment, but it's the same idea. You can edit your latest result here using this link. And for example, I can change to female and see that my risk score is reducing. But when I'm doing all the questions, then the system will automatically show me this page, which is actually the summary page. It shows me what was my score and what does that score mean, being high risk, and then also what I can do about it. So I can do risk emulation and get more knowledge about my risk. I can do some modules, namely this 4 modules, and then I can also set some goals. These are the 2 most relevant goals. So this is a personalized recommendation based on the CDSS that I described. So among all the modules that are available, these 4 are highly recommended to me by the system. I can do other modules, but these are what the system is suggesting to me. I'm also going to the risk emulator. This is also a feature that is interesting. So it shows me my latest score here. And as I'm changing the question, all the 29 questions will appear on one page. And when I'm scrolling down, For example, if I change, I was taking fentanyl in the last 6 months. If I say no, I was not, then I can see that my risk score is reduced by 3 points. If I am enrolled in an OAT, opium agonist treatment, then I can see that it will further reduce by 2 points. And in this way, I can get a knowledge that how changing different behaviors or risk factors can change my overall risk score. So in this way, this is about HRA. And so there are 2 other assessments. I'm not going into detail of them, but GAT7 and PHQ-9, they're also standard assessment. I'm filling up these questionnaires, and then when I submit them, then the system will show me my score. For example, here, 14 or 16, and there is a description of what those scores mean. So I'm going back actually to the assessment if there is any question here. Is there any question from the audience? Great. So I will continue. So if there is no question about this, I will continue with the modules. So the module is actually for gaining knowledge. If I click on the modules, then I will see this page. Module is the module section is actually giving information and providing knowledge, and also is a way to interact with the system and learn some techniques, behavioral techniques. So in this way, some of the modules are designed more toward the substance use, like safer injection, opioid overdose, substitution treatment, or naloxone withdrawal. But there are also other modules that are more general, like positive psychology, problem solving, risk management, metacognitive training, pain management. And I will start with one of the modules, but before starting, I have to say that, as I mentioned, some of the modules are designed for more information, and they're about providing some information like the substitution treatment, versus others that are more interactive and interventional, like problem solving. So I will start with the substitution treatment. So if we click on the link, then there is an introduction for all of our modules. Sometimes there are videos or cartoons or explanations.
Welcome to the Substitution Treatment module. We're glad to have you here. In this module, we'll learn more about substitution treatment. Along the way, Dr. Scott McDonald will answer some frequently asked questions.
I'm Dr. Scott McDonald. I'm a family doctor.
So this is the introduction, and there are texts in the introduction, but the main part is that the lessons. So we have between 10 to 15 lessons, mostly in all of our modules. And for example, you can see them here. And those that you have been completing, they appear with a strike through line, and then a check mark on the other side. Where those that you haven't been doing, they appear with no check mark. And also I can do sequentially using this continue button. I can go sequentially one by one from the start, or I can randomly check based on what is my interest. For example, I can select this lesson. Many of our lessons, as you can see, we had designers and people who were interested in designing cartoons, that they helped us with that and created cartoons.
In the next lesson, we'll be talking about costs that are associated with substitution treatment. In British Columbia, certain substitution medications are covered. If you receive income assistance, are covered by non-insured health benefits.
So in this way, it's a combination of different things, videos and also text. And at the end, I can say mark complete. And if I complete this module, then it will be added to the list of my modules, to the list of the lessons that I have been doing. Sorry. So in this way, we can see that here, this has been also added to the list of my existing modules. So I will also introduce some of the more interventional modules, like as problem solving. The problem solving module is more, as I mentioned, the kind of interventional. In contrast to the modules that we had there, these are more kind of sequential modules. For example, in this 5W, if I click on this, I will see three characters here, and we have cartoons for each of them that they're introducing. So as these characters are going through their journeys, their problems, and they try to find solution and explain those solutions and find and plan for those things, people will learn and will interactively work with the system to go through the problem solving module. So is there any question regarding the modules, and specifically any kind of substitutional and problem solving modules? I can also add one more thing about all of our information and education module, that they have quizzes at the end and frequently asked questions, so that they are all competency-based modules.
I think what I hear, and I just also answered the same question, Fiona, as you, it's publicly available. And if you're interested in a user training where you can really get some input in terms of how to integrate it into your existing service, how to use RAMP for yourself or for a peer, that we are providing a user and a power user training. You just contact us and we will share the next available training session with you. And also to add a little bit to what Alireza also said, there are more topic-focused things like on substitution, safe injection, and similar things, explaining that, what the risks are, what the advantages are. There are CBT, also cognitive behavioral therapy modules. There are models on general topics like the one we are just going through, the positive psychology and problem solving module, and others. And what we are working on is to adding additional interesting topics which are relevant for high-risk substance using users, and to provide more content, which is also not just focused on, for instance, opiate use, but it's also including traumatic experience, depression, like with metacognitive training, or other things. And we're adding to that material on a monthly basis. So that's what I wanted to add. And the training, we are supporting as much as we can, because in the end, the implementation into the current system of care is key for any further development.
There was a follow-up question too about registration from other provinces. So there's no geographical limitations to the use of RAMP at all. So any province, even another country, but probably only the limitation would be the current list of available resources are navigating health services, substitution treatment services in the lower mainland area. So that probably is the only, I suppose, limitation of using it outside the province, but I think there's plans to scale that up as well.
So I think I will discuss also about the resources. what we develop is exactly what you're mentioning, Fiona, but yes, they can even develop themselves the resource, further the resources part, and then we can add it to the existing resources. So there was also another question regarding the registration link. So I can also share again. So if this is the walkalong.ca, ramp2.walkalong.ca is the link. And then in order to register, you can click on this link, which will take you to this page, user registration, and then you put your email. It doesn't need to be like your real email. You can create an email, and there is no verification mechanism that we want, for example, to be a real person that with an organization or something. And you can create your own Yahoo, Gmail, or whatever email you want, and then the first name, last name, and username, and then you agree with the terms and conditions, so the privacy statement that we have here, and then you can register. I hope that this answers your question. So I will continue with the features. So the next feature that I'm discussing is the goals. If I click on this link, then I will see this page. So the goal is the part that you can have a planning for yourself. And we have goals and health tasks, as I mentioned. Goals are high-level goals that we want to achieve. For example, be safer with my drug consumption. The objectives, the SMART goals, they're appearing as the health task. For example, going to drug testing site. I want to do it once daily. And as you are doing that, every day that you're coming, this is getting zeroed, and then you add 1 to it. And this is only one time. So if it is twice, then you can add to this. And then and it will show that how much you have had compliance with what you have to do, and what is the last day that you did this task. So, and if I click on this schedule, then I will see that on what days I have been doing. For example, from 7th to 13th, I didn't enter into the system and I didn't do, but 5th, 6th, 14th, 15th, 16th, and 17th, I did it. So it will appear with the blue color. So this is only a task that I'm doing every day. So it's either I can do it or not. But for example, for this one, there are days that I haven't been doing. So I did it partially and I did it on these days completely. So I can have also weekly kind of, yeah, like this on the weeks, and see how it is done, or if it is partially done like this. So this will show the progress of one health task of one goal. If I want to compare health tasks or I want to compare goal, that's through the life chart that we will explain later. If I want to ask to the task that is existing for a goal, I can add a new task like this easily and go, and for example, using one drug at a time, and then I will say how many times and with what frequency, and I will add it to the list. If I don't want to work on a certain goal, then I can click on it and I can archive it. I can't delete a goal, but I can archive it and get rid of it in a way. But at any time that I want to bring it back, I can click on it and bring it back again and work on it and monitor my progress. So, and if I want to add new goals, it's here. I can add new goals. Those goals that are suggested by the decision support system are coming with a little star. These are the one that the system is suggesting to me based on my answer to the HRA. I can go and I can check, for example, this that was suggested to me, I already took. So I can check another one and I can go through the health task. And as I mentioned here, you give the frequency and everything, and then it will register and I will have it here. So this is a little introduction to the goal. So the aim of goal is that we create a plan and, for example, 2 to 3 goal maximum, and monitor it through the life chart and also this schedule. if there is any question, I can answer. If not, I'm continuing. So the next feature that I'm describing is symptom diary. So if I click on symptom diary, there are certain domains that I can register my daily symptoms. So in contrast to the assessment, which is usually done between every 2 weeks to 4 weeks, this is on a regular basis. Every day you can register your symptom. The questions are fairly short, and I can show, for example, and you do it once a day maximum. And here is what I get as the result. For example, it shows that on Monday, I had 6 symptoms for my depression. I had similar on Tuesday. It will also show on this button that what kind of symptoms I did have. Among the 8 symptoms, I was experiencing 6 of them on both days. And if I want, I can select a different time span and see how I was doing. For example, here I had 5. And the same thing. So I'm going to another domain, anxiety. So I will do one test here so that you can see that how easy is it. Yeah, I can say that I had these symptoms, this symptom, and this symptom. And then I complete it. So in this way, it will register. And I can see that yes, I had the symptoms and this day, on this day, these 2 symptoms, both of them. So this is the way that I can register my symptoms. And as I mentioned, the symptom diary is actually having depression, anxiety, trauma, withdrawal, sleep, social interaction, and some other domains. If there is
may I add a few thoughts? The idea is really how to connect the self-assessment with the interventions, how to direct also users or support users in kind of connecting the dots for themselves and providing a range of tools, because most or all the patients more or less are not only having problems with high potent opiates, they also have everybody individual reasons why they're using, and we want to provide as much background information, feedback, interactional options to address their specific needs and to engage them as best as possible. So the range of assessments we are doing or will improve very shortly, will increase, so that you can kind of document how you're doing over time and for different conditions, which is also, it's a very basic and very useful thing. Like Ian Hickey also said, if you are having a long-term view on what's happening, you understand that sometimes you are in good mood and better mood, and sometimes you are in worse mood. And then the question is also what may have an impact on your current situation. And this is what we want to help people to do with REM. And the second thing is connecting it to a specific risk model. And that is what we saw in the beginning, that there is a heat map, which is showing how, in that case for overdose, how would we, based on scientific evidence or an experience on existing literature, how would we assess the specific risk situation of individuals, and what can they do to improve or to decrease their risk situation. So the purpose behind it is also, if you kind of think in this model, like there are risk factors and there are protective factors, how can I strike the balance as best as we can? And we want them to make then a decision. That's the goal setting part, to achieve certain improvements to improve their overall situation. I just want to repeat that because it's very complex and it's very difficult to summarize it in a few minutes. But this is the core thinking behind the clinical model we are promoting. So yeah, that was my additional comment.
Thank you very much, Professor Krausz. So if there is no question, I will continue with the next part. So the journal, if you click on the journal is a place that you can actually have your word like and write it down, a diary or more kind of free text format. Although we have structured it so that there are questions based on the domain. For example, if the domain is symptom reflection, is a free flow or pain reflection, then different question will appear on here, but still the same idea. You can say about your mood and type something here, and then at the end you can register it. And here you can also access to the previously completed journals that you have. For example, I can view here my previous journals, as you see, and or create new journals. So this is a very short demonstration of journals. So it's a place to reflect on the day or on your symptoms and register them and keep it for yourself. So the next feature that I'm going to discuss is life chart. So as I was briefly describing, if you click on the link, the life chart, you will see this page. So this is a place that you can compare different symptoms. You can compare different assessment. You can compare goals, health tasks, or compare even symptoms, assessment, and goals. So this is a fairly more like visual presentation and more complicated feature. I can do it for 1 week, like this. For example, these 2 days. As you saw, I was registering depression and anxiety and trauma. I can compare them. For example, I can see that I did the anxiety, and this is the result here. And or I can compare it even with my GAD-7 result, or I can further compare it with the goals that I have been doing with the 3 health tasks of this goal that I was doing this week. So it's all gives the opportunity to me to compare things. And if I want to actually further explain one of the functionalities here, I can also increase the time span. If you remember, we did the same thing in the assessment. So in the high risk assessment, it was also possible to increase the time span to 2 weeks, 3 weeks, or whatever I want. Here is the same idea. I can go to the My Life chart and increase the time span to 2 weeks and compare my symptoms over 2 weeks, for example. It will become like this. Or I can compare it with my result in the GAD-7 or GAD-7, HRA, or PHQ-9, and I can see one of them or all the 3 at the same time. So, and then also compare with my health test. The idea is that to see that if I have a good day, for example, my symptoms are better, or how it will affect the assessment, or if I'm complying with my health task, and do I have a better day? Do my symptoms improve, get better, and does it have any reflection on the actual HRA that I'm doing? So in this way, you can combine different things. Of course, you can have all of these 3 separately. For example, I can have the goal, compare this goal and this goal. I want to sleep better, I want to eat better, and compare it for this specific day and see that how I was complying with this, or have it for a longer time span and see the results. So it's actually the same idea. So here is the same idea. So the life chart overall is a place to compare different features that are complex to demonstrate, and it's difficult to have a chart for each of them separately, so you can have a comparison between them. If you have any question regarding the live chart, I can answer. If not, I can move to the next feature, which is actually achievement. So if you reach a certain milestone, then the system will give you a badge. Basically, here is a trophy wall that all your badges appear, those that you have been doing, and also it will tell you about those that you haven't achieved. For example, this, I don't know, for example, seasoned journalist. It says journaling for 7 days in a row, and I got that because I did this, and I did the journaling for 7 days, and so I got this badge. So and I can see which badges I have been getting. These 3 I got, and then those that I even didn't get, like this well-prepared. But I can at least know, if I click on it, I can know that, for example, when I'm completing withdrawal module, then I can get that badge. So it gives me both the earned and unearned badges. If there is any question regarding the achievement, I can answer. Otherwise, I will move to the resources. So as Fiona also told, we have a section called resources, and these are facilities that are available near you. So if I click on that, this is like a GIS, Geographical Information System. It's using Google My Map. If you have your cell phone and open this app on this web app on your cell phone, and you have Google Map, then you can also have the GPS functionality added to the functionalities, and you can see where are you and what are the facilities around you. So here, for example, I can see those kind of, for example, I have only selected mental health services. I can also add, for example, addiction services, or only search for addiction services, or for youth services. And then when I'm clicking on this, it will provide me with more information about the center, the hours of operation, the phone number, website, probably if they are doing e-scheduling, a way to get into their, get an appointment from them, and many more information. So this is, as I described earlier, this is developed through Google My Map, and you can complete it for your area or for whatever area that is even not in Canada, and we can easily connect it to our system, our web app, and then it will become a more comprehensive information about different regions. So if there is any question about the resources, I can answer here. If not, I'm moving to the other section, which is art with a meaning. So art with a meaning is a place that people can reflect on pieces of art, like sculptures, like photos or paintings, and different things that are drawings and different things that are available. And for now, we haven't added the functionality that people add by themselves, but we are planning to add that feature too. But at this moment, this is the only place that people can reflect on a piece of art and communicate with each other. So this reflection part allows people to give a reflection and start a chat among themselves. Of course, it's a moderated environment, and the moderator has to see the post, and then it will go live if it is okay. And then you can also give a like to a certain art or add it to your favorite. And then you can also check based on the domain of that art. For example, we have different domains like anxiety, community, and then these are categorizing them. Or you can see what you have selected as your favorite and check what are the different reflections on that specific feature, or go back to the gallery. So by saying this, these are the features that are the most important features that are available. And I will go back to the home. The home page is now on the My Journey page, which we call My Journey page. This concludes all the interactions of the individual with the system. For example, high-risk assessment, PHQ-9, GAT-7 in the assessment section, what was the latest score, when that was achieved, and then also what modules were suggested, and how much you completed, what is the percentage of completion of a specific module, and what were the goals that were selected, and how many task entries were done, for example, in the certain period, if it is weekly, based on a weekly basis, or if it is daily on a daily basis. So it says the latest interaction with the goals, and also when it is the latest symptom check that was done for each of this domain. So this is the way that it concludes all the interaction with the system. So if we log out here, so then in this way, I can show you also those features that were available. Now you know about those features. All of those features that I said, they are available also without any registration, like the modules that we described, like positive psychology that I described, or the substitution treatment that I discussed. So these are all available. The only major difference is that when you are browsing them, when you're there is no registry. It doesn't save into your account. So there is no tracking system. If you do the module, if you complete all the lessons, nothing will be recorded. So you won't have a personalized experience. If you want a personalized experience, then you have to register. So I will stop sharing here. Thank you very much, everyone. And I'm open to any question or any comments.